Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to show you 6 different ways on how to check a temperature. First, let's talk about what is a normal body temperature. In the adult, it can vary anywhere between 97 degrees to 99 degrees Fahrenheit, with the average about 98.6. In a child, it can also vary anywhere between 97.4 to around 100 degrees Fahrenheit. And anything greater than 100.4 is considered a fever in both the adult and child. The first way we're going to check a temperature is through the mouth, so orally. And you can do this one of 2 ways. You can use a digital thermometer, which is most commonly used, or you can use a glass thermometer, which really isn't used as much because they can break. So let me show you first how to use this glass thermometer. Before taking an oral temperature, you want to make sure that the person hasn't consumed anything. And if they have, wait about 15 minutes before taking the temperature. So what you want to do is you want to perform hand hygiene and don gloves. Anytime you're taking an oral temperature, you may be encountering oral secretions, so you want to prevent yourself from getting contaminated. Then you want to make sure your thermometer is clean. So clean it with alcohol prep and let it dry. Now with glass thermometers, you have to pay attention to where the liquid is on the reading scale. If it is above 98.6 degrees Fahrenheit, you will have to take your wrist and flick the thermometer down for that fluid to go below 98.6 degrees. Once the fluid in the thermometer is below that point, you'll want to insert the thermometer in a probe cover just to protect the thermometer from being contaminated anymore. And then take the thermometer and insert it in the patient's mouth. Have the patient lift up their tongue and put it underneath the tongue. Okay, keep it close. And wait for 3 minutes and then remove the thermometer. Once the time's up, you'll take the thermometer out of the patient's mouth and read the thermometer. Then what you'll want to do is remove the probe cover, clean your thermometer with alcohol prep or whatever your facility wants you to clean it with, doff your gloves, perform hand hygiene, and document the temperature, especially the route. Now let me show you how to check an oral temperature using a digital thermometer. Of course, what you want to do first is perform hand hygiene and don gloves. And make sure you're working with a clean thermometer, so always clean it with alcohol prep. Then you're going to take the thermometer and insert it in its probe cover. Then turn the thermometer on by hitting the button on the thermometer and insert it in the patient's mouth. Have the patient lift up the tongue and then put it over and then keep the mouth closed. And then once the thermometer is done, it will beep. Once the thermometer beeps, take the thermometer out of the patient's mouth and read it. Then when you're done taking the temperature, be sure to remove the probe cover, clean the thermometer per your facility's protocol with alcohol prep, and doff your gloves, perform hand hygiene, and document the temperature. Another way you can take a temperature is through the ear via the tympanic membrane. So first, what you want to do, of course, is perform hand hygiene, get your thermometer, and with these type of thermometers, you want to use a probe filter. So place that just over the thermometer, turn your thermometer on, and you're going to insert this in the ear. For the adult, what you'll want to do is you want to take the pinna of the ear, pull it up and back. If your patient was less than 12 months of age, you would want to take the pinna and pull it down and back. So we're going to pull it up and back. We're going to insert the thermometer in the ear. Then we're going to hit the button to take the temperature. Just takes a second. Then we will read our thermometer and it will display the temperature right here. Then after reading the temperature, what you'll want to do is take the probe filter off and perform hand hygiene and clean your thermometer per your facility's protocol and document the temperature. A third way to take a temperature is through the armpit, the axilla. So to do that, what you want to do is get a digital thermometer, perform hand hygiene, make sure your thermometer is clean, and insert it into a probe cover. Then turn the thermometer on and lift up the person's arm. Place the tip of the thermometer directly into the armpit, not on the clothing. Have them close the armpit and hold the thermometer there until it beeps. Once the thermometer beeps, take it out and read it. After reading the thermometer reading, take the probe cover off, clean the thermometer, perform hand hygiene, and document. Another way to take a temperature is through the temporal artery. So to do that, of course, we want to perform hand hygiene, get our thermometer, and with this specific thermometer, it has a cap cover, so take it off. It does not have the little filters that go over it. Some models do. The manufacturer just recommends cleaning the thermometer. So make sure your thermometer is clean with alcohol prep or whatever your facility requires you to do. What we're going to do is we're going to hold in this button, keep it held. We're going to go to the middle of the forehead and swipe the thermometer across the forehead to the hairline and then release the button and read our temperature. Now, let's say that the patient was sweating, had a lot of sweat on their forehead. How we'd want to do that is, again, hold the button in, go to the middle of the forehead, sweep across to the hairline, and then go behind the ear and read our thermometer. Then clean your thermometer, recap it with the protective cover, perform hand hygiene, and document. Another way to check a temperature is rectally. So to do that, you want to perform hand hygiene and don gloves when checking a temperature this way. You want to get a thermometer and you want to make sure it's clean. Then insert the thermometer into a probe cover and then lubricate the tip of the thermometer. Then turn the thermometer on and have your patient positioned on their back with their knees bent. Then insert the thermometer into the rectum about 1 inch. Then remove the thermometer once it beeps and read the temperature measurement. After reading the temperature, take the probe cover off, clean the thermometer, doff your gloves, perform hand hygiene, and document. Another way to take a temperature is through the skin using a temperature strip. And to do that, you want to perform hand hygiene, peel off your strip, and put it on the forehead. And after placing the strip, within 15 seconds, a dot will start to appear, and whatever turns green will be the temperature reading. Then once you have read the temperature, just take the strip off and dispose of it. Then perform hand hygiene and document. Now you may be asking yourself, which route is the most accurate? According to the experts, the rectum is the most accurate route to take a temperature. The least accurate route would be the skin or the armpit. So always use that as last resort. And whenever you take a temperature in the rectum, it's always going to read about a degree higher than the mouth. And if you take a temperature in the armpit, it's going to read about a degree less than the mouth. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.